The world of NASCAR continues to mourn legendary driver Kyle Busch in the wake of his sudden passing, and tonight we now know how he died. According to a statement from his family, Busch died from severe pneumonia leading to sepsis. Busch died on Thursday, 3 days before he was set to run the Coca-Cola 600 at Charlotte Motor Speedway. He was 41 years old. And earlier today, I sat down with a doctor of pulmonary and critical care medicine at UNC Hospitals in Chapel Hill who explained how pneumonia forms and how it can cause sepsis.
The most important point is early recognition as far as making sure you're evaluated and get treatment early.
We now know that NASCAR legend Kyle Busch died after severe pneumonia progressed into sepsis.
Pneumonia is an infection of the lungs, specifically in the air sacs of the lungs, that then fill up with inflammatory cells and inflammatory fluid that then can progress and make it difficult to breathe.
Dr. Kenton Dover, a physician in pulmonary and critical care medicine at UNC Hospital at Chapel Hill, says symptoms include cough, fever, chest pain, and more, and can stem from either a viral or bacterial infection.
Viral pneumonias are often contracted just by spread from person to person. So typically like respiratory droplets or aerosolized droplets that we might breathe in the community, or with lack of hand hygiene and sharing germs that way. Similarly, that can also happen with bacterial pneumonias, but often in that setting, it also occurs when people have underlying lung disease or smoking history.
He says sepsis happens when the body's immune system essentially goes haywire when reacting to an infection.
You get full body inflammation. In the setting of pneumonia, that would be an infection that starts in the lungs, and then the immune response to that becomes overwhelming and starts to affect other organ systems. So can affect things like the heart, the brain, the kidneys, the blood vessels.
And he says while pneumonia is a common condition that can be treated,
the minute patients develop symptoms, it's good to get checked out to make sure it's not something more serious that would need more aggressive care.